Good afternoon. I'm Congresswoman Alma Adams, representative of North Carolina's 12th District and co-founder and co-chair of the Black Maternal Health Caucus. I'd like to recognize President Latricia Adams and Ambassador Vanessa Vassell for centering Black maternal health and environmental justice in their research, advocacy, and community engagement. Tonight's session, For Us, By Us, prioritizing Black maternal health and policy, will highlight the importance of the Black Maternal Health Omnibus Act and other policies that prioritize reducing preventable morbidity and mortality among Black mothers. This conversation is incredibly important and timely as our nation continues to grapple with the pervasive systemic racism, including in our environmental, energy, and healthcare systems. As we all know, low-income Black, Brown, and Indigenous communities are disproportionately hurt by negative environmental impacts. And environmental injustice, systemic racism also directly affect one of the biggest public health crises of our time, Black maternal health. In the US, the rate of maternal mortality is now worse than it was 25 years ago. For Black women, the risk of death from pregnancy-related causes is a staggering 3 to 4 times higher than for white women. These health disparities that Black mothers and infants face are further exacerbated by environmental racism. For example, Black communities are disproportionately exposed to air pollution, which studies show can increase the risk of premature birth and low birth weight. The maternal health crisis and all its causes must be addressed. And that's why last April, Congresswoman Underwood and I launched the Black Maternal Health Caucus, and it's why earlier this year, our caucus unveiled a comprehensive legislative package to address these issues. The Black Maternal Health Omnibus Act of 2020 is a package of 9 bills that build upon existing legislation to comprehensively address the maternal health crisis. Our legislation would train providers to screen for social determinants of health, including environmental risks. And to help address those risks, it commissions a study on the impacts of climate change and pollution on maternal and infant health outcomes. The Omnibus provides a roadmap to ensure our healthcare system, lawmakers, and society prioritize Black and Brown maternal health. Because Black mothers have the right to spend their pregnancy in safe, stable, affordable, and adequate housing, and have access to affordable, nutritious foods. Black mothers and their doulas have the right to be listened to and treated with dignity and respect during the sacred event of childbirth, whether at home, in a birthing center, or in a hospital. Black mothers have the right to be cared for by providers free of bias, racism, and discrimination. No Black woman should die due to neglect, dismissal, or mistreatment. Black mothers have the right to welcome and raise their baby into a home that's free of lead-contaminated water. Black mothers have the right to raise their children in communities free of air pollution and contaminated soil and exposure to extreme temperatures. But unfortunately, for many Black mothers and communities across this great nation, birth justice, environmental justice, and racial justice have not been served. So the Black Maternal Health Caucus will keep fighting, and thankfully we are not alone in this fight. The work of such community-based partners as Ancient Song Doula Services, Mama Toto Village, Mom Cares, the National Association to Advance Black Birth, Black Millennials for Flint, and the Black Mamas Matter Alliance is truly moving the needle toward improved outcomes for Black mothers, infants, and families. And conversations such as tonight's panel are critical in advocating for Black mothers, increasing awareness, and developing solutions that are for us, by us. Congratulations on the 4th annual Young, Gifted, and Green Summit, and keep up the good work.